Top 3 uncommon procedures in plastic surgery. What do I mean? These are the procedures that I think have great results that patients are extremely happy with that you never hear about on social media. Number 1, fat transfer to the back of the hands. When we do a facelift on patients and we make them look like they're 50 instead of 60, the very next place that they all talk about is the back of their hands, because that's the place that shows your age the most. So I like to use fat grafting to the back of the hands to decrease the visibility of the veins and tendons on the back of the hand and to really take away some of the aging that's occurred back there. It's important because you put sunscreen on your face, but you always forget to put it on your hands, so the skin quality is always crappy here later on. Number 2, fat transfer to the ears. Same concept. Facelift does rejuvenation, and then they're left with like an old hanging looking ear, or maybe there's deflation here in the lateral part of the ear where things kind of get foldy and flat. Adding just a small amount of fat makes the ears totally rejuvenated in a big way, and it helps it to match what you see in those facelift photographs. Number 3, inverted nipple repair. This is a surgery that doesn't only improve the way that the nipples look and the breasts look, it's also a functional surgery if you preserve the quality of the duct, if you don't cut the ducts on the inside. I've written papers on this. I like to talk to patients a lot about it. I get a lot of people that come from all over the United States for a procedure that seems so silly, but is actually incredibly valuable and changes people's lives in a big way. So those are my top 3 rare plastic surgery procedures.